Hello and welcome to our webcast for December 15, 2017. My name is Christian Debré and this is Amy Asbrook, the Director Toro Vivant at Dediet. Also joining us, Taylor Hyatt, the Policy Analyst and Outreach Coordinator. Toro Vivant.
Hi, everyone.
Sorry, Taylor. Okay. Toro Vivant at Dediet is a non-religious organization by and for people with disabilities and our allies. Our goal is to inform, unify, and give voice to the disability rights opposition to assisted suicide, euthanasia, and other ending of life practices that discriminates against people with disabilities. Today's topics, we have two, like we do most of the time. Review of Canadian disability rights legislation, Prince Edward Island. Second one is the Ontario NPP introduced Palliative Care Bill. So, to talk about it, Amy Asbrook.
That's me, and I'm talking about it. Okay, the first topic is a review of Canadian disability rights legislation for Prince Edward Island. Welcome back to our analysis of accessibility legislation in Canada's provinces. Today, we're looking at Prince Edward Island. Like most other provinces, PEI doesn't have a comprehensive disability rights law. Instead, there is a patchwork of government programs and services. And that's kind of what we've come to expect living in Canada. The Human Rights Act prevents discrimination based on disability, among other factors like sexual orientation and age. But as we've noted before, it takes more than just adding disability to the list of prohibited discrimination to remove physical, program, and attitudinal barriers. So an entrepreneur can say, oh, I don't exclude disabled people from my business. And if there's 5 steps, then
Go inside the building.
Right, you can't get in. So yeah, there is an exclusion.
You're not excluded, but you're excluded.
Right, exactly. So it takes more than just saying, oh yeah, anybody can come in. So financial support is available under the Social Assistance Program to help people who are unemployed and those who are unable to work due to a disability. Besides a small amount of income for basic living costs, it also pays for medication, basic dental care, glasses, and funeral costs. A separate disability support program provides things like respite care, community living supports, mobility devices, and other assistive technology. So generally, when you're talking income support programs, you're talking people living below the poverty line because they don't provide enough income to have a living wage.
But like what we ask as disabled people is to live a bit over the line.
Yeah, that would be kind of nice. Okay. Provincial home care services are available for anyone who is in need of support to continue living safely at home, is home from a hospital and recovering from surgery or another medical condition, or has an ongoing health issue needing more care than they and their loved ones can manage.
Oops.
So
everything's fall apart.
Right. It's up to the individual to go to the last herb of their energy to provide their own care, and then the province will step in, as opposed to a more rights-based model, which would say, you know, everybody has a right to assistance with home care, and that would provide the assistance that everybody needs. Okay. Whoops. How did I do that? Sorry. I skipped ahead. Okay. Here is a list of the services offered under the home care program. Nursing care, such as health monitoring, IV therapy, injections, wound care, and teaching people how to care for their injuries, which, you know, nursing care, that's fairly straightforward. Personal home support, which is for assistance with daily activities such as bathing and dressing, doesn't say whether it covers housekeeping chores like, you know, loading the dishwasher and doing the laundry. So probably, but we don't know. Sometimes they won't, take out the trash or something like that. Covers palliative care, social work, individual and family counseling for illnesses, loss, or end-of-life issues. Covers dietitian services, physiotherapy, occupational therapy, referrals for adult protection in cases of abuse or neglect, assessment for nursing home admission, or day programs for seniors, including respite care. So those are all the things that are under the home care program. The barrier-free design regulations of the Provincial Building Code Act require that entrances, exits, and washrooms of new and renovated buildings be accessible to people with sensory and physical disabilities. So it doesn't talk about path of travel within the building, doesn't talk about no steps to the front of the building. It may be that those are hidden somewhere in the code and you have to be an expert to know where to find it, but if it's not obvious, it's easy for people to get around it. Oh, I didn't know. Gee, sorry. Other than the placement of toilet paper dispensers in relation to a toilet and grab bar, nothing specific is spelled out in the code.
So if they put that thing in the building, they are respecting the law. Right, exactly. And it's not enough.
Right, so even if there's 5 steps, as long as they have a grab bar in the bathroom, they're okay. There are 3 exceptions to the regulations. One is an existing building which is not barrier-free. So the owner doesn't have to do anything to an existing facility. They can just, let it go on being very inaccessible for as long as they want. Construction that began before the accessibility regulations came into force in 2004, and in addition to an existing building with barriers that is incidental or meant to increase the size of a room. So they have to, when they do renovations, they have to make it accessible unless they can say, well, this isn't really important to the function of the building. This is just incidental. We're just making this room a little bigger. It's not that important, and we don't have to be accessible. So, and believe me, they do. They try that.
Basically, when it's not the right regulation, any government could change it the way they want, increase it or lower it the way they want, and nobody could tell it anything about it.
Right, and these are very difficult to enforce because you have to be on top of the building inspector so that they know what the regulations mean, because if they don't understand why you have to have a 4-foot turning radius, then they're not going to enforce that. They're going to say that when the building owner says, we don't have enough space for a 4-foot turning radius, they'll say, don't worry about it. So you have to be on top of the building inspectors to make sure your rights are enforced. The Rehabilitation of Disabled Persons Act allows governments to provide grants and loans for diagnosis, counseling, training, and transportation, tools, books, and equipment for rehabilitation, dental care, drugs, medical and surgical supplies and prosthetics, and foster care and other forms of substitute care. So those are some of the programs that enable people with disabilities to function more in the community in Prince Edward Island. It's a small province. It doesn't have a lot of funding, so probably a lot of these programs are drastically underfunded and have long wait lists.
Maybe just sometime existing only on paper.
Yeah, we don't know. We haven't heard from any advocates about how effective they are, so that's something to know. Taylor, did you want to add anything?
Except, well, man, that really leaves a lot of buildings that need to be renovated. Not really messing around, being sarcastic.
Yeah. Okay, our next topic is an Ontario member of the Provincial Parliament introduces palliative care bill. Ontario MPP Sam Oosterhoff introduced a bill to improve access to palliative care in Ontario, the Compassionate Care Act, on November 27th, 2017. The bill requires the Ontario government to develop, quote, a provincial framework on hospice and palliative care provided in hospitals, home care, long-term care homes, and hospices. Hospitals, right, okay. This framework, okay, so this is just to set up a framework. And there are some guidelines for setting up the framework in the bill, but otherwise it's left pretty open. And the framework will define what hospice and palliative care is. So there'll be a legislative definition of what palliative care is. And an important point there is whether assisted suicide and euthanasia are going to be included. And Taylor, did you want to say something about that?
Yeah. Earlier today, I got really excited because Mr. Oosterhoff and I are actually former colleagues. I know his stance on assisted suicide quite well. He shares our position. He's against it. But I forgot about things like amendments and the 100 other colleagues that he's going to go head-to-head with, that they might try to sneak assisted suicide in there as a valid part of palliative care.
Right, and that's just during the lawmaking process. That doesn't count what happens after it becomes law and the administrative departments get a hold of it. Because a lot of these laws are so vague and so wide open in general that they need pretty extensive rulemaking to happen in order for them to be implemented. And if somewhere in the rulemaking it says it's okay for hospices and palliative care centers to do euthanasia and assisted suicide, then, you know, the battle is lost.
Yeah.
So
this law became null and non-effective.
Well, it's not quite null, but it definitely takes on a very sour taste. The framework will also identify the training and education needs of healthcare providers as well as other caregivers. It will identify ways to support hospice and palliative care providers. It'll promote research and the collection of data on hospice and palliative care. We know how important that is because Canada has had a euthanasia law in effect for a year and a half and still hasn't come up with regulations for collecting data.
Yeah, and
right.
Collecting data could be very, very simple as the number of people who have used it.
Right.
And that's it. Could be the report.
They could decide that that's all the data they want to collect, which would be very, very bad. They also want to identify measures to facilitate consistent access to hospice and palliative care across Ontario and take into consideration existing hospice and palliative care frameworks, strategies, and best practices. Now, I was reading that wrong because in the law, it says hospice/palliative care. And it puts those two together, and those two things are not the same. Hospice is for people who are dying, and palliative care is for people who need pain relief, but who are not dying, like this can. So that's an important point.
My sickness is not curable.
Right.
So I still have palliative care.
Yeah. The Minister of Health and Long-Term Care will develop the framework, quote, in consultation with hospice palliative care providers and any other affected ministries, federal government, and entities that the minister considers appropriate. Unquote. The consultation will begin within 6 months after the act comes into effect. So, you know, basically, the law really doesn't have much content. It provides a process. And again, what we talked about before is the process is out of the line of, it's not in the legislature, so it's not really public. You know, they'll call for people to to submit papers, but it's not really, they're not obliged to make it public what people contribute, and so they can decide essentially what they want. Okay.
How will we know that disability groups are being consulted? Will the minister consider them appropriate?
Right.
And 6 months later, that seems awful late.
Yeah. Yeah.
Yeah, we agree. It's
Right.
awful late.
Right. Especially since the euthanasia law will have been in effect for 2 years by then.
Yeah.
So.
And still no regulation.
Right.
Most of the time.
Right. The health minister will prepare a report for the Ontario legislature on the new framework 1 year after the act takes effect. It will be published on the Ontario government's website 10 days after being given to the legislature. Yeah. Within 5 years after the report is submitted, another report on the state of hospice and palliative care in Ontario will be given to the legislature. So 5 years after the program starts, there's another report that will be written. It will also be published on the government website. So that's their effort at transparency. Yeah, after closing the barn after the horses have gone out. Okay, the law is long on generalities and short on specifics. We don't know anything about the framework yet. We'll have to wait and see over the next year or so what they put in it. Another problem with the bill is its lack of clarity. There are repeated references to hospice palliative care without an and, as if they are the same thing. And we just talked about it, they're not the same thing. The MPPs voted on the bill's second reading yesterday. It passed with a unanimous vote and will now go to a committee hearing and third reading. Mr. Oosterhoff wants it to become law before the next election. So did you want to add anything about that, Taylor?
One thing I did want to mention is the bill doesn't mention assisted suicide at all. So it doesn't mention whether palliative care centers are going to have to provide it as a key part of their services. Other than that, for the next election, I don't know when that is.
Right, it doesn't mention it at all, and we don't know whether it's going to be a big issue in the election. Probably not, but it could be a bone of contention in the debate on the bill, whether euthanasia and assisted suicide will be part of the definition of palliative care. So that could get heated at that point. If you want to read the full bill and learn more about it, you can find it at our website and on our Facebook page with the text that we send along every week. The bill is available in both English and French, and it's a long URL to find the bill. A similar bill proposed by federal MP Marilyn Gladu in 2016 will become law soon. It received unanimous approval by the Senate last week and royal assent on December 12th. Gladu told the Black News that the Minister of Health will meet with Provincial officials within the next 6 months to develop a federal framework for palliative care. That sounds familiar. Their plan will come into effect a year after the meeting. According to the newspaper, Gladu says the bill has been publicly endorsed by over 100 organizations, including the Canadian Medical Association, Canadian Nurses Association, and Cancer Society and Kidney Foundation. So, great. It's got a lot of endorsements. It's probably pretty non-controversial until you get to the thing about what is the definition of palliative care and does that include. So did you have anything else you wanted to contribute, Taylor?
Just that Mr. Oosterhoff's bill got a similar level of support.
Yeah.
He said in a press release yesterday, a couple days ago that he got support from the Registered Practical Nurses Association, ALS Society of Canada, and the Ontario Caregiver Coalition, which is a whole bunch of groups, including the Centre for Addiction and Mental Health, Parkinson's Canada, and the MS Society.
Yep. Yeah, so it's, I mean, it's kind of a no-brainer to support palliative care, but people aren't necessarily paying attention to what's going to end up in the bill, either through the legislative process or during the rulemaking process afterwards.
And if the euthanasia and assisted suicide are in or out of the bill.
Right.
Never know.
Right. There's three possibilities. One is that it won't be mentioned at all, and so individual centers will do what they want. And the second possibility is that palliative care will specifically be defined as including assisted suicide and euthanasia, which would be very bad. And the third possibility, which is very, very unlikely, is that palliative care will be defined specifically to not include assisted suicide and euthanasia.
The probability is they will not talk about it.
Right. 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 Because I think if they try to pass the bill with an exclusion for those things, it will fail. And, you know, so they'll probably just try to leave that issue aside. And so then it gets to the rulemaking process, and the public loses control at that point. Okay, so that's it for this week. For more information on the subjects we discuss, you can visit our Facebook page at facebook.com/toujourvivant, not dead yet, all one word. Visit our website at tvndy.ca. You can email us at info@tv-ndy.ca, or you can follow us on Twitter at @TVNDY. Two things. One is last week we missed a little milestone that we achieved, which is 150 webcasts. So in both languages. So that's 300 webcasts that we've done so far. Yay! And the other thing is we're taking our annual holiday break, and we'll be back on January 12th. So have good holidays, everybody. Thanks to Christian and thanks to Taylor for helping out. And we will see you in January.
Merry Christmas and Happy New Year.
Happy holidays.
Happy solstice. Everything that means peaceful for everybody.
Whatever you celebrate, have a good one.
Yeah. Exactly.
Great. Thank you,
Take
Taylor.
care.
Take care, everybody. Bye.
Bye.